Okay, so we have Alicia here with her lateral knee pain. We took a look at her extension range of motion. We looked at strength of some muscle groups in sitting. We found that there's some hip external rotation on her impaired side or on her painful side. And so sometimes too, after the sitting, I would have the patient go for a walk with and without shoes to kind of look at gait. I don't get a ton of information out of just walking gait, more out of running gait and running kinematics. So, but I might just have them take a little walk just to sort of reset the patient and keep them relaxed. Okay, so let's take a look at Alicia's knee. Like I said, usually there's not a loss of range of motion. It's about 130, 140 degrees of knee flexion. No problem there. I might do a quick screen of flexibility. So maybe a little tight in the hamstring, but nothing that would scream that there's the big problem there, right? And a little tight there, no problem. If I suspected there was some trauma, I could do, a few special tests, but she doesn't describe anything that makes me think that there's an LCL injury, MCL injury, meniscus injury, PCL or ACL injury, nothing like that. It's really just pain in the lateral knee. Okay, full knee range of motion, decent flexibility in this position. And so I suspect there's some hip weakness, so let's take a look at her hip strength lying here, okay? Keep this leg as straight as you can. Lift it right up in the air. Good, hip flexion, push up against me. Let's do that again. Push up against me. Okay. Left side, straight as you can, push up against me. Okay. Do you feel a difference left and right?
Yes.
Yeah, so right leg feels a little weaker, right? Would you agree with that?
Yes.
Let's turn on your right side and face everybody. Okay, we're going to look at gluteus strength. I'll look at the left side first just for fun. I bring the patient up and back into a little bit of hip extension. Good. I sometimes support the spine there. Push up against me, and I push hard. Good. Okay, so she's decent. We'll call it maybe a 4+ out of 5. Let's flip on over to the other side. Right. Lift up, bring her back into a little bit of hip extension. I'm just going to push on up, or push down, push up against me. Right, so that's a 4 out of 5. So she has, do you feel a difference between the right and the left? Which one is weaker?
The right one.
The right one, yeah, so we have some weakness there, right? Okay, sometimes in this position too, I'll do a little Ober's test, but I don't find a lot of information about it. People tend to move the pelvis around and try to get Ober's test. Bend your knee. We'll take a look and see, is there tightness? Let it go, let it go. Is there tightness in the IT band? Do you feel any pain with that?
Not me, but I feel stretch.
Yeah, where do you feel the stretch? Down here?
Yeah.
Yeah, right to there. So there might be a little tightness there. And if I find that, I'll give her a little stretch to do, just to elongate that iliotibial band so it doesn't compress the lateral knee structures when she's running. But really what we're seeing is a little tightness here, but a little weakness in the gluteus medius. Go ahead and lie on your tummy. So I'm just systematically working through this. Let's look at quadriceps flexibility, no problem. On the right painful side, quadriceps, no problem. You okay?
Yep.
Good. And then since we're here on the painful side, I'll just crunch on the joint, no problem. No meniscus injury, right?
No.
No problem there. Good. And then we're gonna keep this right leg straight, lift it up in the air. Do you mind if I put my hand on your back?
No.
Gonna just support her spine here. Just push up against me, don't let me push you down. Okay, push up against me, don't let me push you down. Good, let's look at left. Push up against me, don't let me push you down. Okay, is there a difference between the left and the right? Do you discern? Push up. Yeah, you might be a little stronger on the left there. So we have some gluteus weakness on the right side. Okay, so we have some good impairments that we can start to really kind of bring together to why is Alicia having lateral knee pain when she's running, iliotibial band pain. We know that the research shows that sometimes faulty gait kinematics and weakness in the gluteus muscles can cause this. So let's take a look functionally at what's going on and see if we can drill down a little bit further before we give Alicia some exercises to work on to start to strengthen her glutes.